Good morning and good afternoon, everyone. My name is Rudy Inaba. I am the Global Director of Cenegenics Nutrition and Exercise, headquartered in Las Vegas. I'd like to thank everyone for attending today's webinar on metabolic syndrome and the 5 factors you need to know. I'd also like to thank you in advance if you've been attending our other webinars, most recently our Alzheimer's risk factors and how Cenegenics programs can help prevent many of those risk factors from developing over time. So Thomas Edison said that the doctor of the future will give no medication, but will interest his patients in the care of the human frame, diet, and in the cause and prevention of disease. And that couldn't be any more significant today when we talk about actually metabolic syndrome. And metabolic syndrome is a combination of having some of the symptoms related to obesity, issues with blood sugar and insulin sensitivity that are trending towards type 2 diabetes, hypertension being elevated blood sugar, and 2 components of dyslipidemia, one being a poor HDL or low good cholesterol, and the second one being high triglyceride levels. So obesity, elevated triglycerides, reduced HDL, elevated blood pressure, elevated fasting glucose, all of these things can become a vicious cycle with lifestyle components that over time can start to develop into diagnoses of diseases. So metabolic syndrome is defined as a cluster of biochemical and physiological abnormalities associated with the development of cardiovascular disease and type 2 diabetes. Over 1/3, slightly over 1/3 of US adults actually have metabolic syndrome. And that equates to, that also aids into the numbers of 30.3 million US adults having diabetes, which is around 10% of the population. 630,000 US adults actually die from cardiovascular disease per year. So it's 1 in every 4 deaths. And I believe that the statistics equate to maybe it's a cardiovascular death 1 every 40 seconds. And that's related to heart attack. So this can affect people, typically when we just talked about some of those symptoms, it would be more common to think of someone with a very large body weight or excess weight. And that is in fact a major contributing factor. However, it is not always the case. People that are normal weight, they can have elevated body fat percentages. They can also have higher blood sugar, higher triglycerides, and also low HDL, being that good cholesterol. So historically, the concept of metabolic syndrome has been originally conceptualized in the 1920s by a Swedish physician who was associating hypertension with hyperglycemia or elevated blood sugar and also gout. Then in the late 40s, there was an association with visceral obesity or trunk fat around the midsection, with metabolic abnormalities of cardiovascular disease and type 2 diabetes. Then in the 60s, it was presented in a European Association for the Study of Diabetes on how obesity is related to type 2 diabetes. And then in the late 80s, it was actually renamed as Syndrome X, and then revisited again in the 90s as insulin resistance syndrome. So metabolic syndrome has gone from simply a concept or a theory, but then over time has really, grown and developed into an actual recognizable syndrome that is essentially the pre-occurrence of disease. So metabolic disarrangement becomes a syndrome when 3 of the following things happen. So of these 5 components, if you have 3 of them, that could be a diagnosis of metabolic syndrome. Waist circumference over 40 inches for men or over 35 inches for women. And we'll get into the specifics of where the waist circumference measurement should be taken. The waist circumference is going to be more indicative of excess body composition. Typically, when someone has higher levels of body fat levels or excess fat tissue, that's going to significantly impact the waist circumference. Another marker is elevated triglycerides, and that would be above a 150 milligrams per deciliter. Reduced HDL, which is a low good cholesterol again, which would be less than 40 for men and less than 50 for women. And elevated fasting glucose level, so blood sugar in the fasting state of around 12 hours, higher than 100 milligrams. And then also an elevated blood pressure with a systolic value being higher than 130 millimeters of mercury, or a diastolic blood pressure being higher than 85 millimeters of mercury. So any 3 of the 5 would contribute to a classification of metabolic syndrome. The leading constituents that are going to impact these 5 parameters or these 5 biomarkers we're looking at would obviously be insulin resistance, visceral adiposity, which is that central fat, that visceral fat around the midsection, atherogenic dyslipidemia, issues with HDL and also triglycerides, endothelial dysfunction. So having the issues with triglycerides and also cholesterol and excess fat tissue, that can impact the intermedial thickness and much of how the endothelial system should function. Genetic susceptibility is another component. Elevated blood pressure, as we mentioned, a hypercoagulable state, which is more of an increased tendency for coagulation or blood thickening or clotting. And chronic stress can also do this as well. So now we're going to get into each one of the 5 components, kind of look at them a little bit further and see what kind of impacts they have on our lifestyles. So the waist circumference is a circumference or girth measurement, which is at the waist, quote unquote, at the waist. Based on the American College of Sports Medicine, they suggest that a waist circumference measurement be measured roughly 1 inch above the belly button or the umbilicus or navel. However, there is some room for some subjectivity there. It can be the smallest portion of the waist above the belly button, but below the sternum. So really there is some variation from women's components because we want to measure the smallest part of the waist. It does aid in representing the distribution of body fat or weight. And because it is a large predictor for health risks associated with obesity and visceral fat and the waist circumference fat, people that have equal weight, so if I have a 200-pound male on one side and another 200-pound male on the other, the one that has the smaller waist circumference is actually going to be at lower risk for hypertension, type 2 diabetes, dyslipidemia, and also cardiovascular or coronary artery disease. If he has more of that weight distributed to the upper and lower extremities, that is a very simple way of measuring body composition because there's not excess fat tissue in the truncal region. So the same risk factors for waist circumference we see with obesity. So visceral adiposity, elevated body fat percentages, low muscle mass, many of the influences with obesity that we are all familiar with through media or through our previous webinars or through Cenegenics programs. Major influences for obesity are obviously diet, exercise, stress, sleep, hormones. There are a lot of components that we've gone over repeatedly that can significantly impact obesity. And they all work synergistically together to either improve or actually worsen the trait. Triglycerides is another one. And so triglycerides are 3 molecules of fatty acids combined with 1 molecule of alcohol glycerol. It is a form of fat stored by the body. So people only really think of stored body fat as our storage fat. However, fat is also stored as triglycerides. It is produced by the body and from foods that we eat and drink. So it is heavily influenced by the types of fat that we're eating, either excess fat or excess foods. And also alcohol intake can influence triglyceride levels acutely. So when we are doing triglyceride measurements, looking at the biomarkers from a blood draw, we do want to have the triglycerides on a 12-hour fast as well. Triglycerides can be lumped together with lipid profiles. However, triglycerides are different from cholesterol. Cholesterol can be used to build cells and aid in hormone production from sterols. And triglycerides are actually storing unused calories and also providing immediate energy. One interesting thing we see is that when patients do significantly lose weight and they are dropping body fat percentages that are confirmed from their DEXA scan analysis, we actually can potentially see a short-term rise in triglycerides, and we do a follow-up, it comes back down, typically due to the fatty acids being released from the stored fat. So chronically elevated triglycerides are also associated with significant risk factors. Specifically arteriosclerosis, which is the hardening and thickening of the arterial walls. So at Cenegenics, we measure a carotid intermedial thickness test where we actually use ultrasounds and first do a plaque check of the carotid artery just below the bifurcation of the carotid. Following the measurement under the bifurcation, we'll actually do a lateral ultrasound that measures the thickness of the intermedial wall. And over time, if that becomes thicker and thicker and thicker, that's going to be increasing our risk for vascular disease or arteriosclerosis. And then to combine on top of that, if we have issues with low HDL levels and elevated LDL levels, that can significantly increase more associated risk factors with atherosclerosis. So measuring this information is going to be important over time to really track your progress, but also to potentially see risk factors that are developing before they're recognized in serum testing or from symptoms. So large influencers of elevated triglycerides are overconsumption of food. If we overeat, typically we're overeating foods that are easy to eat, things like processed carbohydrates, baked goods that have really poor fats in them. They're more inflammatory fats. They're things that are very easy to consume and overconsume. So that can significantly increase postprandial triglyceride levels, and also too much alcohol can influence triglycerides. High density lipoprotein. I know we've all heard of HDL in the media, from your physician, from different webinars that we've done. But HDL is our good cholesterol. That's what it's commonly recognized as, and it removes cholesterol from our bloodstream and deposits it in the liver to be excreted by the body. LDL, in contrast, collects in the walls on the blood vessels as plaque. So HDL, that's why it's considered our good cholesterol, because it aids with cholesterol removal. High HDL lowers risk for coronary artery disease and stroke, which is, again, another reason why we measure our risk factors with carotid intermedial thickness testing. And it is an important factor in the coronary risk ratio. So coronary risk ratio is done, it's a biomarker that we look at when we do our blood draws on patients and measuring our biometrics. And it's a measurement of total cholesterol divided by HDL. So typically, if we see a value around 4, that's going to be kind of our borderline range. So we want to have a lower total cholesterol, and we want to have a very high HDL. So there are many potential influencers, and these all have synergistic components with all of these 5 common factors we're looking at today. But poor diet can significantly impact your HDL levels. If you're eating foods that are inflammatory, and going back, inflammatory foods can be more inflammatory fats, so excess omega-6s, foods that are heavily processed, so your simple carbohydrates, things that are low in fiber, low in nutrients, low in phytonutrients, those can all accumulate on a day-by-day basis, week by week, month by month, and year over year. Eventually, decade over decade of having a diet like that will significantly influence our risk factors with disease as we get older, and metabolic syndrome would really be the first stop. Lack of exercise is another. High-intensity interval training or high-intensity cardiovascular exercise is preferred for increasing HDL levels, as we've been able to see that doing high-intensity interval training and working up into the anaerobic metabolism can actually start to increase HDL over time and start to reduce overall cholesterol, total cholesterol. Excess fat tissue can lead to poor HDL. There's an association with fat loss simply just boosting HDL. If we have someone that comes in roughly 30 to 35% body fat, and we see a 5 to even 10% reduction in body fat, we can almost automatically see a increase in HDL. However, that association isn't necessarily cause and effect, because there were certain things that were attributing to that fat loss as well. Smoking and also being exposed to secondhand smoke can also significantly reduce HDL. Obviously, directly smoking will have more of an impact, but secondhand smoke can also do damage over time. Again, these aren't single acute environments that we would be in. This is something that's happening repeatedly, year over year, decade over decade. And excess alcohol consumption along the same. So low to moderate alcohol intake does have some benefits based on what you're reading and what kind of studies are being presented. However, more evidence is always needed, because almost for every couple positive pieces of data we see, there are also potential negatives. Things like this with the elevated triglycerides. Really, we need to take an individualized approach and find where our thresholds are for each person. Fasting glucose is another. So the body utilizes glucose as an energy source. We store glucose in our muscle cells as glycogen, and that's our immediate energy source. If we need to run down the hallway, or if we're going to lift a big weight, glucose is our preferred energy source in most individuals. And blood sugar levels also rise after meals. So based on the size of the meal and the makeup of the meal, that's going to influence our blood sugar levels. When we break it down by individual foods like carbohydrates, that's going to be like in reference to glycemic load over glycemic index. Glycemic load is going to be how much of an impact that carbohydrate is going to have on blood glucose levels, so how much actual blood sugar it will yield. And glycemic index would be what's the makeup of it, how quickly is it going to hit the system. If it's very high in fiber, or if it's paired with a good fat or a high amount of protein, it's going to be more slowly absorbed into the digestive system, and then there's going to be more slowly increasing blood glucose levels. The amount of glucose will still get there if it's a high glycemic load food, but the glycemic index can have some influence based on other macronutrients that are blended with that. So with blood sugar, insulin is released in relation to the rise in blood sugar. So we've talked about this in previous webinars again, but insulin helps lower blood sugar and then breaks it down for energy use or storage. And elevated fasting glucose levels, because If they're elevated when there's no presence of glucose, that could suggest that we have an inability to lower blood sugar, and that could be from insulin resistance or poor insulin production from the pancreas. Another interesting thing is that there are studies that suggest that glucose and insulin relationship is heavily influenced by our circadian rhythms. Circadian rhythms are something that we've talked about in the past when we talk about sleep hygiene and having good melatonin production and having good REM sleep cycles. And it's just our essential sleep-wake cycles. And when we release melatonin, it starts to make us tired and drowsy and allows us to fall asleep. But it does more than just affect our levels of being tired. It can also impact our organs. So these certain studies I'm referencing, they showed that consumption of carbohydrates, it was either after 7 p.m. or 2 hours prior to bedtime, there were higher levels of fasting glucose in the blood for a longer extended period of time, suggesting that pancreatic function was suppressed a little bit in the evening relative to the circadian rhythm. So it's interesting. So having elevated glucose levels for a long period of time, from chronically elevated fasting glucose levels, that can lead to the development of cardiovascular disease, nerve damage, kidney damage, eye damage, Alzheimer's disease, as we mentioned in our previous webinar, talking about the inflammatory type of Alzheimer's. And it's also directly and indirectly influenced by excess fat tissue, lack of exercise or a sedentary lifestyle. Family history can play a large component. Age also has an association, elevated blood pressure, and also dyslipidemia or poor HDL and elevated LDL levels. And the fifth factor we're going to look at is blood pressure. And there are roughly 75 million US adults, around 32% of the US adult population, have elevated blood pressure or have hypertension. And only half of them have their blood pressure under control, which is significant. High blood pressure was also a primary contributing cause of death for more than 400,000 Americans in 2014. This is statistics from the CDC. And it is also responsible for almost $50 billion in healthcare costs each year. When we talk about blood pressure, we're referencing two numbers, as I mentioned before. For metabolic syndrome efforts, if it's something over 135 for systolic blood pressure, or if it's over 85 for diastolic blood pressure, that would be a potential check mark for our metabolic syndrome. Systolic blood pressure is that first number. It's the top number on your blood pressure, and it's the pressure in blood vessels when the heart beats or when the left ventricle contracts. Whereas diastolic blood pressure is the pressure in blood vessels when the heart rests in between beats. So that's the differentiation between those two numbers. So major influencers to blood pressure, stress is another common one. That's going to be somewhat of a more an acute response. However, smoking, overconsumption of poor foods, sedentary lifestyle, being obese or overweight, and chronically consuming too much alcohol, those can have a chronic elevation in blood pressure, which again, over time, is not going to be a positive thing for our health markers and also potentially increase our disease risk factors as we get older. So the positive things are that each of the 5 factors that we discussed today are really, and you're able to have significant control over them. So I'm asking everyone that if you are elevated in any of these numbers that we looked at today, to really take action with nutrition, exercise, and additional lifestyle components. So there are many, many modifiable things we can do in our lifestyle to contribute to metabolic syndrome. Again, metabolic syndrome isn't a be-all, end-all disease. It is a period of time prior to the advancement of disease progression like cardiovascular disease and type 2 diabetes. So essentially, for many patients or for many individuals, it is that wake-up call or aha moment, as I've referenced in other webinars. So things like hypertension, we can adjust, or elevated blood pressure. Hypertriglyceridemia, that can also change. That's that elevated triglyceride level. Dyslipidemia with poor HDL and high LDL, elevated glucose, and also our obesity marker being waist circumference. These can all be managed. These are all biomarkers we can look at during examinations. So blood pressure readings, looking at blood values, look directly at fasting triglyceride levels, looking at your lipid profile being HDL, LDL, coronary risk ratio, elevated glucose levels from looking at our tests. In addition to elevated glucose, we would be looking at insulin levels and also hemoglobin A1C. And waist circumference measurements we can do with a tape measure. For elevated triglycerides, there are additional lab tests we could look at to look for any kind of suspicions of that could be leading to that occurrence outside of lifestyle. Now we'll be looking at your thyroid stimulating hormone, potentially doing a full lipid analysis, a urine analysis, and also managing liver function as well. So not to oversimplify, not to undervalue the components of lifestyle, but really to make things easy for the individuals, we want to focus on a large scale of these components. So a high fiber diet, focusing on vegetables and fruit as our primary sources of carbohydrates are going to yield such a positive response in elevated glucose, elevated triglycerides. Over time, that's going to help with our body composition, our body fat levels, reducing our obesity. Vegetables and fruit are going to be high in phytonutrients and high in fiber, so that's going to give us a lot of different benefits. They're going to make us full. They're going to keep us satiated. Same goes with proteins. Proteins are going to help us stay satiated. It's also going to increase our thermic effect of food, which is a fairly large component of how many calories we're burning per day. We do want to focus on higher quality animal proteins, foods that are, if it's fish, meaning wild caught fish, if it's red meats, being grass fed or free range or wild caught meat. Leaner cuts, as we're not going to be over consuming to increase our triglyceride levels. These higher quality sources are going to yield higher essential fatty acids. We want more omega-3s in our diet versus omega-6s. And having those choices over time repeatedly, it's going to help us maintain or build our lean muscle mass. It's going to allow us to have a better digestive health with the fruits and vegetables, and just get us on a much better track to start to reduce those risk factors that make up metabolic syndrome. We also want to reduce our alcohol intake. Again, each individual are going to have different recommendations. As a general rule of thumb, 1 to 2 drinks, preferably from a red wine, is going to be more preferred than drinking other options, as there are potential benefits that we could see. It's kind of almost like on a spectrum scale, the lesser of the poor end of the spectrum. We want to limit or remove packaged foods or baked goods for a number of reasons. They're very much likely more calorically dense. In a small portion of a baked good or a packaged food, you would not suspect the higher caloric intake. You would also look at more of the omega-6s or the inflammatory fats that are utilized in the production of that food. The carbohydrate component is also going to be coming from more simple carbohydrates or simple flours. So what that will do, packaged foods, we would typically see a spike in glucose levels, spike in triglycerides. Over time, that will start to impact our waist circumference. And it's just this vicious cycle if it's happening on a day in, day out basis. If it's a rarity and it's not a common thing to include, if it's only, limited to, a few times a year, that's going to be a different story. Resistance training. So resistance training is highly beneficial. It also can help improve HDL or our good cholesterol, but it also helps with our triglyceride levels. It's going to help with our HDL. It's going to help with our glucose levels. Really, if we do have higher blood sugar, then what we can do, one kind of thought process is, well, if I build more muscle tissue, that's going to be able to suck up more glucose and be stored as more glycogen. So building more lean muscle mass, having a better quality of life, having better muscular strength, more muscular power, not only are those going to help with your functional output, but that's also going to potentially help with reducing blood sugar levels, reducing fasting insulin levels, and also improving triglyceride levels as well. Frequency of training is going to vary from individual based on the individual response, things like injury history or what the goals are, but really just incorporating that on a regular basis is going to be important. The same goes for anaerobic or metabolic training, which is essentially my term for high intensity interval training. High intensity interval training is going to be highly beneficial for improving your HDL, also improving your body composition. When we do interval training and those high intensity intervals where we creep into our anaerobic metabolism, we're going to see spikes in growth hormone output. We're going to be seeing spikes in our peak testosterone concentrations after exercise. And as we accumulate more and more high intensity intervals in one workout, we start to build what's called an oxygen debt. And that oxygen debt is repaid by our bodies and our metabolic systems by breaking down and mobilizing free fatty acids from our stored fats after exercise is completed. So for, again, say we have a 200-pound male who is doing 20 minutes of high intensity interval training where he's getting up to his anaerobic metabolism maybe 6 to 8 times and holding it for 30 seconds to 60 seconds. That is an aggressive anaerobic training session. And that could yield an increased fat burn or an afterburn when exercise is completed for anywhere from 12 to 24 hours. Sleep is another one. We want to really get managed sleep, where we're actually optimizing our health, recovering, helping keep our cortisol levels down. That's going to be a large component that's going to help us recover from this more intense exercise that we're starting to include. And the synergy combined with eating more phytonutrients from fruits and vegetables, having high quality proteins with good essential fatty acids, and training and challenging our body to rebuild and make new quality tissue, sleeping to recover is going to be highly important. For much of our patients, when we look at their baseline data, we do see that there are suboptimal levels in hormone production, and we have all the engagement and we have all the motivation to do and execute these plans. However, if we're starting with poor levels of hormone production, that can potentially lead us to, maybe failing the plan after 6, 8, 12 weeks, maybe even, 6 months, because we start to drive ourselves into a bigger hole potentially. For other people, we can turn it around and go in the other direction. However, if we support this lifestyle with high fiber, phytonutrient-rich foods, good essential fatty acids, strong animal proteins, exercise, high quality sleep, and we support that with optimized bioidentical hormones in normal physiologic ranges that are healthy and reduce our risk factors for disease, we're able to sustain this quality of life and this lifestyle for much longer periods of time, which is significantly going to reduce our disease-related risk factors. So those were our 5 factors that define metabolic syndrome. And again, if you have 3 of the 5 or 3 or more, then that can be classified as metabolic syndrome. However, the thing to remember is that metabolic syndrome is a precursor to a disease. So you can actually take significant action and start to reduce those numbers and improve your biomarkers to help get you out of metabolic syndrome and keep our risk factors for disease much, much lower than now. So with that, if you have any questions, I'm happy to answer them right now. If you'd like to speak with our team after the webinar, the number's right there, and also my number directly if you have any specific questions for me. But as questions related to today's webinar regarding metabolic syndrome, I'm happy to take them. So one question we have is, how many days per week should I resistance train or lift weights? And it really depends on the individual. I tell everyone, I might have said this before, so I apologize if I'm repeating myself, but exercise is a stimulus that causes an adaptation. And once we adapt, we need to create a new stimulus to further see the results we want and to continue to, create an adaptation. So the best thing to do is to see where you're at on the training spectrum. If you are currently not doing any resistance training at all, one of the best things you can do is just start. Even starting at 2 days per week or potentially 3 days per week if you can would be a good thing to include. So you're going from that 0 days per week to now 2 to 3 days per week. So focusing in on free weights or total body like compound movements are going to be the most beneficial for caloric expenditure, for hormone response, for energy output. However, if there are potential limitations or injuries, I do suggest starting with maybe some more some lighter movements that are limited to machines or working with a hands-on coach to kind of help with your movement patterns. But then from there, once you optimize that 2 to 3 days and you start to build in a lot of work and resistance training within each session, that can then be changed into 4 days per week or even 5 days per week. Or you can look at it in another way and extend the session length of each individual workout. You can get more sets done in one individual workout. You can increase the intensity of the exercise, being from, maybe doing push-ups to a chest press machine to a incline barbell bench. There's always progressions that can be made. That can be from the exercise selection, from the rest periods, to the amount of volume, to the amount of frequency. And that's why resistance training and exercise prescription is somewhat of an art form, because there's so many things that we can do and change and manipulate to continue to see results. Another question was, I think I saw this one on social media before too. It was, if I could eat chicken or grass-fed beef, which is my better option? And I saw that online from another physician that we've talked to. And really, if you have the choice between like store-bought, chicken breast or a hunter in your local area, I think it was, it's hunting season approaching, who had, fresh, free range grass-fed red meat, I'd always go for that red meat option due to the essential fatty acid content. If you have chickens are typically fed cheap feed. They're higher in omega-6s, so there's not a whole lot of fats there. Whereas if you have more of that locally raised or the free-range grass-fed red meat, that's going to have more high essential fatty acids and omega-3 sources and lower omega-6s. So obviously choosing, a leaner cut potentially, so you're not overdoing the caloric intake. But that's going to be yielding far more phytonutrients for you on a regular basis than having something that's going to be more inflammatory. Can vitamins or supplements help address metabolic syndrome? And they actually can. Really lifestyle is, kind of the foundational approach. However, we can build on top of that foundation, and that's where we would utilize the nutraceuticals. So some nutraceuticals that we could do is going to be things like the ones that can manage our blood sugar levels. So Cenegenics, we have one product that is called Glucomax Protect, and it is a combination of berberine and alpha lipoic acid. Both are classically used to help reduce blood sugar levels. So in times where someone has chronically elevated blood sugar, or they're going to be they knowingly are going to overconsume carbohydrates, that can help kind of take the edge off that spike in glucose that can help improve the insulin response. So that is one way to do that there. There's other options that you could do for triglycerides, really the essential fatty acids. So for someone who is doing that has elevated triglycerides at a significant level, they can actually do higher dose marine fish oils. The fish oils are going to be concentrated in EPA and DHA that have been shown to reduce the LDL and triglycerides as well. So, but one thing to recognize is that not all fish oils are created equal. Really when we go to the store and we see the aisle of fish oils, we think they're all the same, and we just see how many grams of fish oil we can get for the cost of the bottle. So how many servings of grams of fish oil. However, the grams of fish oil, the amount of actual oil, is only really the delivery component of what you're putting in your system. The actual active ingredients are EPA and DHA. And some oils may have something like 200 milligrams of EPA and 150 milligrams of DHA per gram of oil. However, there's highly concentrated ones like a Cenegenics option. We have around 800 milligrams combined EPA DHA in one single gram of fish oil. So that would need 4 grams of this first example to equate to the Cenegenics 1 gram. So there's one thing to remember when you're out in retail or you're online looking for fish oils that are going to potentially help with triglyceride levels, LDL, or just optimizing health long term. You want to focus in on the concentration of EPA and DHA. A common answer is that, well, I can just take more of the cheaper ones, and that is true. However, that can yield things like diarrhea, upset stomach, and that may be a little bit more difficult to do on a regular basis. The question was, going back to the meat, was about what about organic free-range chicken versus wild-caught salmon versus grass-fed meat? They're all good in my book. So I would just say have a variety of foods. So I would have them in on your regular rotation. I mean, that's what I personally do. I have free-range chicken, either actually dark meat like the chicken thighs or chicken breast, a couple times a week. I have wild-caught salmon a few times a week, and I kind of lean more on the wild-caught salmon and the grass-fed beef as my primary sources of proteins, and also the flax meal-fed whole eggs. So I'll incorporate all of those. So they're really all good. I guess really the only thing I would consider for that is that if you are trying to manage your total fat intake, if you're having a higher fat day from other foods, then maybe lean on the grass-fed chicken breasts, or more of like a sirloin or filet grass-fed red meat. For the salmon, you can just do a smaller portion. There's not a whole lot of fat in salmon, but it may be a fattier piece of it. One thing to do, recognize when you are having, say, like a big salad or a big bowl of vegetables with a protein like grass-fed beef or wild-caught salmon or free-range chicken, is that many times we start to throw other things in the salad like walnuts or macadamia nuts or avocado or olive oil and balsamic vinegar. Those are all great things that we can include on a regular basis. However, just to avoid, overconsumption, and not all calories are created equal, and these are all really good foods that I'm talking about. But if you're trying to have weight loss, you want to focus on the quality of the foods that you're consuming, but also you want to pay respect to potential overconsumption at times. So if I have a big salad and I have maybe like an 8-ounce portion of wild-caught salmon or grass-fed beef, but then I chop up a whole avocado and put the whole avocado in there, and I put 2 handfuls of walnuts in there, and I put 2 tablespoons of olive oil. Those are all really great things. And from an inflammatory component, there's really not the inflammatory component that's being affected by that meal. But if I'm eating that many calories, I'm going to have that maybe 3 or 4 more times that day, and I'm not really exercising that day, I could just be over consuming a little bit. So it's just to pay respect to, if you want to have, avocado, olive oil, and nuts, I'd go for the leaner protein source like the free range chicken versus doing the fattier protein source and then adding all those other fats on top of it as well. So hormone therapy can affect metabolic syndrome. So one thing we see, with testosterone, for example, there's an initial response in some people that when you optimize testosterone physiologically, so say if you see someone go from a total testosterone of a 300 up to a 800, normal reference ranges being like 300 to 1100. So they're still well within range. That could still be, a 4-time increase in total testosterone. So there's potential for us to commonly see a mild reduction in initial HDL. However, we see that spike right back up to where it was at a good HDL level at that next blood draw. And that's also while following the high intensity interval training that our teams recommend, following the diet that we recommend, also following the resistance training that we recommend. So it's not something to really be afraid of if you're starting bioidentical hormones and if you're involving those other positive components of the lifestyle. But the big thing is that, if you're building more tissue and you're motivated and you're getting stronger and you have, better libido and you're sleeping better and you're just more energetic and you feel better, you're now not in these suboptimal or deficient levels of our sex hormones. That's going to be adding potential fuel to our motivation or our fire to live this better lifestyle. And that's going to kind of get us going on a repeated basis for our exercise from week to week, from our nutrition week to week, from, we're sleeping well, we have better REM sleep cycles. All of these things start to stack up. And by the end of a year, even earlier than a year, 3 months, 6 months, 9 months, a year and more, we see some really significant improvement in patients. And I believe that the hormone component, it's certainly a component to it, but it's not a be-all, end-all. So you need to do the all-encompassing approach. I have a busy schedule, and there particular exercises I should do to maximize my time. So I always ask patients what the primary goals are, and also make sure that those goals are also reflective of what maybe, red flag items we see in their biomarkers. So say, for example, if someone has elevated waist circumference or high body fat percentage, they have high triglycerides, they have low HDL, they don't really have a whole lot of injuries at all, nothing out of the ordinary, kind of like minor things. I always put high intensity interval training as really our primary option. Having the ability to create EPOC, or that excess post-exercise oxygen consumption, which is what that afterburn is that I talked about, being able to do 20 minutes of high intensity interval training where we get up into your anaerobic zone, where we actually know what our anaerobic targets are from our VO2 max testing, and getting that 4 times, 6 times, 8 times, progressing on the intensity over months, that's going to be yielding a higher fat burn for, again, 12 to 24 hours in some individuals, in some cases more. And that's going to be giving you way more bang for your buck if your number one goal is fat loss, and also if you don't have a lot of time. There's tons of data out there that shows that weight loss from, I think it's 3 20-minute or 25-minute interval training sessions per week versus 5 1-hour low-intensity cardio training sessions per week had similar weight loss. I would go on a limb to say that the fat loss was more prevalent in the interval training zone, or in the interval training side, because not only do they burn more calories, but we also have more of the anabolic hormone output. So we have the spike in growth hormone, we have the spike in peak testosterone concentration. You're going to get a spike in cortisol, but it's going to be an acute response, and the anabolic side of those hormones can help overcome that. Doing the 5 hours of cardio at a low to moderate intensity, you're not going to be getting that peak testosterone concentration. You are not going to be getting the growth hormone pulses, and you're also not going to be getting that high caloric output for such that small amount of time. And you will still have that cortisol. So while low intensity cardio certainly has its place in individuals that have maybe some injuries, or who just prefer to do long distance stuff, it's just their style of training that they like and it keeps them consistent, it has its place. However, if we had someone who could complete both forms of training with their goal being fat loss, and they had a small amount of time per week to dedicate to those efforts, I would always lean towards the high intensity interval training. Looks like we don't have any follow-up questions again. I do invite everyone. If you do have questions, please feel free to speak to our team. You can catch us at 866-240-0035, or my office line is directly provided on this slide at 702-953-1536. So if you have any questions relating to metabolic syndrome, risk factors, things that you can do about them, Cenegenics programs, what different services we offer, I'm happy to take those calls and happy to answer all of them for you.